Some local clinics are offering what's being called antibody testing, which can find out if someone may have already had the infection and didn't even know it. They've just got the antibodies in their system. There's only one antibody test approved so far by the FDA, but many companies have created their own versions of that test, and some clinics, like one in Allen, are offering them. Fox 4's Alex Boyer has our story. Alex.
Hi, Stephen. Some folks were so eager to get some answers that they started lining up at that Allen testing facility before it even opened this morning. The antibody test is gaining popularity, but not all doctors agree on its accuracy. With more and more Texans desperate to find out if they're infected, new private testing centers are starting to pop up across North Texas.
Got the address, punched it into my GPS, and jumped in the car and came.
Susan Hall is one of dozens of people who drove to PAM Rehab Hospital in Allen Tuesday to get what's known as an antibody test. Provided by Cura Telehealth, the drive-through test involves a small blood collection. It can tell if a person has developed antibodies showing that they have or have already had the virus. The tests being administered Tuesday are FDA authorized, but not FDA approved.
Antibody testing is the next phase of testing that we're very interested in.
Speaking to Fox 4's Sean Rabb by Zoom, Dr. Mark Casanova, president of the Dallas County Medical Society, says antibody testing could provide important data to city and county leaders trying to come up with a plan to safely reopen the economy.
What the antibody testing will allow us to do is identify patients who have been exposed to the virus. And the inference, and we need to be careful with this, is that they maintain at least some immunity or some degree of immunity for what is right now an unclear period of time.
But Dr. Nick Carr, who has been providing a diagnostic test that checks for active infection, is skeptical of the antibody test results.
The challenge is that you could actively have a COVID infection right now, and it could be several, 10 days to up to 2 weeks before you start to develop the antibodies to it. So there's a huge lag time there. We're seeing a lot of the tests have a high rate of false negatives. So you get a negative result, and in fact you have had it, or false positives where it tells you had the virus previously, but it was some other virus.
But with all tests still hard to come by, folks like Susan Hall willing to give the antibody test a try.
I figured we're doing this for, the greater good.
And Dr. Casanova also says that there is a new saliva test that will soon be offered at some doctors' offices, which will further expand testing capabilities. Still, he says that it's important for folks to continue social distancing in order to avoid a second wave of infection.